is the cool thing about lasers is like there's an infinite amount of applications for it. So you can use it for musculoskeletal issues, brain issues, gut issues, thyroid issues. So it's one of those things that is a good adjunct to almost any kind of health program that you're doing. It's like this universal.
Yep. And no matter what kind of healthcare provider, my patients are buying them for their own place. Danica's got her set now, things like that. And there's really only one caveat, and that's the dose and energy. You want to actually have lower dose. That's the big misconception with lasers. All the rhetoric out there is like, well, if low level laser is good, then high power must be better. And that's absolutely not true. Right. That's especially when you're doing brain-based applications, because there's this threshold that you hit in cells, whether it's in the brain or other tissues of the body, that you can actually start doing more harm than good. An extreme example would be like a surgical laser, super high powered, and its job is to like zap or ablate tissue. So that's on the real far end of the spectrum.
That's the Austin Powers laser.
Yes. Exactly.
Sharks with lasers.
Sharks with lasers, exactly. Yeah. So the threshold number that you want to not exceed is 10 joules per centimeter squared. I know that's absolute Greek for most people watching, but it just means that if you start getting above that, you can actually cause cell damage. You can cause a lot of these higher powered lasers. It can cause thermal injuries, like too much of a heat load. We're not trying to cook the brain. These higher powered lasers have longer wavelengths that are getting into the like microwave range, for example. As you get up to like near infrared is into that spectrum. And that's great if you're heating tissue and whatnot. And you're just like, that's why those lasers actually have their FDA clearance as a heating device. It's a topical heat lamp, basically. Yeah. And that's fine if you want to do that, but we're not trying to cook the brain. We're trying to make sure the brain gets all the benefits of laser without actually overdoing it.
So it's almost the same as, like, let's say working out. Like, probably one of the things I've also done for myself that's been far better is less.
Yep, the free radical exercise paradox.
I mean,
exactly.
I mean that's kind of when I talked about my EBU treatments and how my oxidative stress was so much better and my inflammation was so much better. It's because for the last month or so I've worked out only like 3 days a week with real weight training and actually taking rest days. And so it's the same story basically.
Exactly.
Is that more is not always better. God damn it, Dad, you taught me that. You told me more is better. If a little's good, a lot is better.